Accountability is a concept discussed in Module 6. The objectives for this concept are to define and describe competency and professionalism as it relates to accountability in the profession of nursing, describe the different roles the nurse assumes in the delivery of patient care across the lifespan, compare and contrast how historical and contemporary influences guide nursing competence and professional development, and explain ways to promote lifelong competence in nursing. Let's first define accountability. Accountability is being answerable for the outcomes of a task or assignment. Nurses are accountable for their own actions, and at times, nurses may also be accountable for the actions of their subordinates or trainees. Responsibility is the specific obligation associated with the performance of duties of a particular role. Nurses' sense of accountability guides their performance, which determines patient outcomes. Accountability requires clear definitions of accepted standards of care. So what are standards of care? Standards of practice and standards of care are professional standards or guidelines used to determine what a nurse should and should not do. These are established by organizations such as the Joint Commission, the American Nurses Association, and the National League for Nursing. It describes the responsibilities for which nurses are accountable. Nurses who choose not to meet these requirements are failing to practice at minimum standard acceptable to the profession and will be held accountable to the patient and to the agency. Acknowledging accountability for both successes and errors helps professional culture remain positive, and honoring successes is as important as examining and correcting errors. So how do we get to be accountable? Aspects of the nursing profession that promote accountability include the requirement to complete extensive specialized training, direction of professional individual towards service, allegiance to a code of ethics, autonomy in the role, and membership in a professional organization. So let's break down a little bit further the components of accountability. Specialized education includes the fact that an individual has earned a hospital diploma, an associate's, bachelor's, master's, or doctorate degree in nursing, and subsequently passed the NCLEX exam. It includes a body of knowledge, a well-defined, expanding body of knowledge and expertise. Knowledge base is a product of various conceptual frameworks within the profession, and evidence-based practice is based on current research. Service orientation is another component of accountability. This is what differentiates nursing from occupations pursued primarily for profit. Nursing is considered to be a profession that's pursued primarily in service to others. Nursing emphasizes the service to others as matter or tradition and is the basis for accountability. And the service orientation of nursing is guided by rules, policies, and codes of ethics. So these are some additional definitions. So let's talk about what a code of ethics is. A code of ethics is a respect for inherent worth and dignity of all people. Nursing professionals must do what is considered right, even at a personal cost. And a code of ethics is, as society needs and values changed, so do its ethical codes and principles. Autonomy indicates that a profession can regulate itself and set standards of practice for its members. For example, the boards of nursing, state boards of nursing. Autonomy indicates that there's a professional status for nurses that depends on the profession's ability to function autonomously in formulating nursing policy and controlling its own activity. There's a legal authority to define its scope of practice, and there is independence at work, responsibility, and accountability for one's own actions. Professional organizations, membership in a professional organization is also a component of accountability. Professional organization is an organizational structure which provides governance of the nursing profession. It could be social and or political or economic arrangement that promotes professional affairs. In this slide, we're going to talk about socialization to nursing. So socialization to nursing would be considered very similar to socialization to any new environment, right? Entering a profession is similar to entering a new society. Socialization is the process of learning to become a member of the group of the society and learning the societal rules and defining the relationships within that society. So basically, we need to learn how to behave in the nursing environment, in the healthcare environment. Traditionally, socialization involves learning how to behave, feel, and see the world in a role as others do in that same role. Professional socialization, however, is more complex and has 4 critical attributes: learning, interaction, development, and adaptation. Before these attributes can be attained, there need to be in place comprehensive educational programs, which is what you're part of right now, competent faculty who are also role models, and then adequate field experiences. And you are, this is all part of the program in which you're involved. So interaction with fellow students is a powerful driver for professional socialization. So you're not yet professional nurses, but you're getting into the thinking in that environment, okay? Socialization among nursing students naturally and collectively sets norms for and determines the direction of scholastic efforts, right? So you collectively gather as a class, and you also a few of you have told me that you have a group of partners from the lab or from the class, and so you are setting the direction of the scholastic efforts in your group. You develop perspectives about situations, goals, and appropriate activities and behaviors. You establish a set of practices in keeping with these things. Students and classmates become bound together by feelings of mutual cooperation, support, and solidarity. And many of these feelings continue after the students graduate and enter the professional nursing world. Nursing education helps students develop individual professional values. Education helps clarify and internalize these professional values. And one way, another organization that helps students do that is the National Student Nurses Association, which addresses students' responsibility in the academic environment and society in the nursing environment at large. Many factors influence nursing as a profession. The factors that influence a profession also affect the entire healthcare system. Economics is one of these factors. Changes in public and private health insurance programs have affected the demand for nursing care because it changes the way that providers are providing care, and have also caused individuals to delay care, which puts them, when admitted to the hospital, in a further deteriorated state, increasing the demand for nursing care and competent nursing care in the hospital. There is a shifting emphasis from inpatient to outpatient care. So what we want to do is shift to prevention of illness and disease. We've talked about that. And if we can have individuals participate in preventive care, that will prevent them from having to go to the hospital at all, and hopefully being able to know that they're not well or know that they're becoming sick and seek care sooner to avoid coming to the hospital at an advanced stage of their disease or illness. Acute care remains the primary nursing practice area. More nurses are being employed in community-based health settings, however. So this is going to be things like preventive care, like could be the health department, or it could be home health care where patients are being discharged from the hospital but still require a level of care. Specialty areas have developed to meet patient needs, and various models of integrative care are used to better control rising healthcare costs. So again, we're using preventive medicine, hopefully more effectively. We're using care of participation of nurse practitioners and physician's assistant in the place of physicians that can help decrease healthcare costs. Another factor influencing nursing practice and accountability is consumer demand. So the consumers of healthcare are the general public, and the consumer needs drive any market or service, whether it's healthcare or anything else. So there is an increased need for integrative health services motivated by more than just the need to consolidate and lower costs. Okay, individuals are looking for quality care. And it's also motivated by consumer interest in complementary health approaches. So an increase in preventive care, an increase in alternative therapies, an increase in use of Eastern medicine strategies such as acupuncture and massage and holistic medicine with maybe herbal medications used. Consumers today are more knowledgeable and vocal about their needs, and this is in part due to the availability of information on the internet. Further factors influencing nursing practice and accountability are science and technology. Advances affect nursing practice, competence of nurses, and the accountability of nurses. Genetic testing is available outside traditional healthcare systems. Nurses must expand their knowledge base and their technical skills to keep up with changing practice. Healthcare practitioners are expected to learn how to use technology such as sophisticated computerized equipment. Practitioners must be able to use online electronic health report systems. And innovations have had a dramatic effect on nurses' clinical training. So there's an increasing availability of simulation-based training activities, and you've seen that in nursing school. Also, there's the same simulation-based training activity used in the workplace. Some hospitals have their own sim lab and things used in a simulation-like environment where nurses are not practicing on live patients. The simulation-based training activities have been shown to improve clinical decision-making and also have a positive effect on student learning as well as patient safety. Additional factors are the information availability and telecommunications. There's an increased use of internet that affects healthcare. Patients have become better informed about health concerns and treatment options. The forms of telecommunication that have influenced nursing practice and accountability are video conferencing, telepractice, telerehabilitation, and virtual office visits. Telehealth is the provision of long-distance healthcare through technology, so we've seen that frequently during COVID when you see your provider over like Skype or Zoom. And then telenursing is the delivering of care through telecommunication. So the same thing might be provided. Maybe we make home visits with our home health patients through the screen. Maybe we can check in on them and we can do an interview assessment, or we can at least lay eyes on them and decide whether we need to see them today or if we can maybe wait another day to make a visit. And there is some legislation that impacts nursing practice and accountability. There's the Patient Self-Determination Act, or the PSDA, in which legislation is determined that all competent adults must be informed in writing at the time of admission of their rights to accept or refuse medical care and to use advance directives. And in many organizations, nurses are responsible for ensuring compliance with this law or similar regulatory requirements. So patients are provided with a copy of their rights on admission to the facility, and which lets them know that they do have the right to refuse any and all medical care. The current nursing shortage has also influenced nursing practice and accountability. Registered nurses make up the largest group of healthcare providers, but there are fewer nurses entering the workforce. So that means that the nurses who are in the workforce are aging, and so the group of working registered nurses are older. Some geographic areas are experiencing acute nursing shortages. The shortages are especially prevalent in areas such as critical care, and they are only expected to get worse. Let's look at some of the factors that affect the shortage. The nursing school enrollment is not growing fast enough to keep up with the workplace needs. Aging nurse workforce, I just mentioned. There's a shortage of nursing faculty, which this is, to be quite honest, what drives nursing school enrollment. There have to be a specific number of faculty per student in the clinical setting, and that's per state board of nursing. So we have to have faculty in order to admit a larger number of nursing students. The changing demographics of our patients. If there's an aging population, the baby boomers are getting older, and so this is the baby boomers who would be registered nurses themselves would be of retirement age and getting ready to leave the workforce or have left. There's an increased demand for nurses. As I said, in the acute care setting, patients are sicker. And then there are also workplace issues. Staffing shortages sometimes lead nurses to leave the workplace because of less than desirable work environment. So how can we address the current nursing shortage? There needs to be collaboration among healthcare systems, policymakers, nurse educators, professional organizations in order to address the shortage. And some of the recommendations that have been made for addressing the shortage include giving nursing students the means to enter and progress rapidly through educational programs quickly and efficiently. There's been recommended step-up efforts to recruit young people early in their education, middle school and high school, to pursue nursing. There have been recommendations to improve the nursing and work environment by providing more scheduling flexibility, better rewards for experienced nurses who serve as mentors, more adequate staffing, and increased salaries. And also to increase funding for nursing education so students can pursue their nursing education. Okay, let's test your knowledge. A nurse would like to implement an evidence-based practice change that will influence client care on the medical surgical unit. The nurse works with the nurse manager and other members of the leadership team to write a new policy and produce educational materials for the unit staff and clients. In carrying out these actions, the nurse is practicing which standard of professional performance? Is it A, leadership, B, collaboration, C, evaluation, or D, collegiality? Correct answer is B. The nurse is practicing collaboration by working with other staff members to implement a policy change. Collaboration involves working with clients, their families, and others in the conduct of nursing practice. Collegiality describes interaction with and contributions to the professional development of peers and colleagues, as would be the case in a mentoring relationship. Leadership involves providing direction in a professional practice setting. Evaluation involves a comparison between one's own nursing practice and professional practice standards. Second, test your knowledge. A nurse educator is conducting a continuing education in-service for the nurses in a pediatric intensive care unit. Why is it so important for the professional nurse to attend these in-services? A, most states require it to maintain licensure. B, it is a good way to receive overtime pay. C, research and new technology demand that nurses stay current. Or D, new diseases are discovered every day. The correct answer is C. Research and technology are constantly changing and improving client care. Professional nurses are accountable for staying abreast of new information by attending continuing education courses. Receiving overtime pay is not a reason to attend continuing education courses. Although new diseases are discovered regularly, nurses wouldn't necessarily need an ongoing training on the diseases themselves, but rather on new ways of treating diseases. Finally, although many states do have continuing education requirements for nurses, new technology and research are the most important reasons for staying current. In fact, these changes are the reasons why continuing education is required by most states.